Hello everyone, I am Dr. Pratyush Kumar and this video is all about family medicine. What's the future holds for the young PG graduates of family medicine in India? What's the status of family medicine globally? So these are some of the important points which I'll be covering in this video series of family medicine. So before I start, let me introduce myself. I am Dr. Pratyush Kumar and I have done DNB family medicine from Sir Gangaram Hospital, Delhi. So what are the further specialization in diploma fellowships after family medicine? There are lots of fellowships available or diploma programs available for diabetes. There's distance fellowship in diabetes by CMC Vellore is there. Then there's also one for infectious disease, allergy, HIV, maternal and child health, palliative care, rheumatology. So these are being offered by various institutes. MRCGP programs are there. MRCGP is recognized worldwide. So that you can do. There are online programs and workshops. There are various institutes. Even WHO has also started offering online programs for medical health professionals. There are other eco and USD training programs. We can search it online. And this is just to add some additional skills or just to upgrade your skills. There's alternative additional interests. Like if you're interested in environmental health or planetary health, if you're interested in genetics, artificial intelligence, digital health, rural health, research, education, global health, or tropical medicine, then obviously you can just develop these topics as your area of interest and you can read further, you can grow, do some research work, or you can do some PhD programs in these topics from institutes all over the world. We have got some good opportunities in research areas also. You can publish case report series, thesis as original articles. You can also do many studies and publish as original articles. You can submit pictures and letter to editors. We have our Academy of Family Physicians of India has got a PubMed index journal, which is Journal of Family Medicine and Primary Care, which really helps many PG students to publish their articles in this journal. Even although it has got a publication charge, but for many students, if you're really serious, the, the journals they waive off the registration, the submission charge if you're submitting in this Journal of Family Medicine and Primary Care. This is the sole purpose of promoting family medicine globally. And then there's another Journal of Surgical Specialty and Rural Practice. This is also another journal from Institute of Family Medicine and Primary Care by Dr. Kumar. I'm the chief editor of this Journal of Surgical Specialty and Rural Practice. Then the more International Journal of Rural and Remote Health is there. And similarly, there are many family medicine journals by different associations all over the world. So there are lots and lots of journal for if you are looking for journal in family medicine and primary care to publish. If you're really interested in research, then we have got our association is there to help you out. In India, it's difficult to understand the breadth and depth of family medicine, but globally, family medicine is very extensive, very wide, and has got lots and lots of interest areas and working parties. I'm just sharing you the Wonka's working party and special interest group. This has got working parties on education, environment, ethical issues, e-health, mental health, quality and safety research, rural practice, international classification, and women and family medicine. So these are the working parties which work very effectively to promote family medicine in these domains. And also there are special interest groups on adolescents and young adult care, aging and health, cancer and palliative care, complexities in health, emergency medicine, emerging practices, models for family medicine, genetics, health equity, indigenous and minority group health issues, LGBTQ health, non-communicable diseases, point of care testing, policy advocacy, quaternary prevention and over medicalization, migrant care, international health and travel medicine, family violence, and workers' health. So these are different interest areas. If you're interested in any of these areas, you're free to join these working parties and special interest groups. It's open for all the family doctors all over the world. I would like to invite you, if you're interested in rural health, to join rural practice Wonka working party on rural practice, which is also known as rural Wonka, one of the most active working party of Wonka. And we also host our biannual conferences like Wonka. So if you're interested in any of these interest areas and working parties, then feel free to join these working parties. All the details are there available in the Wonka website. And it's very free to join these working parties. And I'm very much sure that you'll learn more and more while after joining this working party. So now coming back to our Indian context, we have got Academy of Family Physicians of India. We have got our state chapters in different states. The Young Doctor Network is there, which is called Spice Route. There is General Family Medicine and Primary Care. Then there is Indian Medical Association College of General Practitioners, and then we have Federation of Family Physicians of India. So these are the associations which works to promote family medicine in India and also globally. So this is the take-home message which I really want to convey, because nowadays lots of discussion going around role of family doctors. What would be the role of family doctors when their nurses practitioners coming up, and they are government is trying to promote mid-level health workers to take up the primary healthcare roles. So in that context also, and also the role of MBBS doctors and versus the family medicine specialist. So is in that context you need to understand that what this profession is all about. Any profession is all about. If a profession is failing to meet a public need, the society will find some way of meeting the need, if necessary by turning to a group outside the profession. Profession evolve in response to social pressures, sometimes in ways that conflict with the expressed intentions of their members. So every profession is all about meeting the demands of society. If a family medicine specialist, there is a demand, then there will be supply of family doctors. If that's why I told you the number of skills, the competencies, if we practice family medicine to the full extent in primary areas, in secondary areas, there will be demand. People will start realizing the need of family doctors. Yes, it will take time, but we need to understand that everything is dependent upon the utilization of our services. If society feels our need, if government will be pressurized to recruit more family doctors, and society will only understand the need if we showcase our skills, if we give our services in the primary care areas, in the primary care level, at the secondary care level, and we meet their demands, then only we can influence policymakers, government to take family medicine to a next level. Thank you.